Hello everyone, welcome back to our discussion on human genetics. Today we are going to discuss about the second type of gene disorder, which comes under inborn errors of metabolism, and that is phenylketonuria. So we'll see this particular video about phenylketonuria, and we'll move on to the discussion. So this phenylketonuria is a rare
Phenylketonuria, or
metabolic disorder,
PKU,
and this
is a
is
rare metabolic disease that can lead to severe brain disorders caused by the accumulation of the amino acid phenylalanine to toxic levels in the blood and brain. Amino acids are the basic building blocks that make up proteins. Phenylalanine, or Phe, is one of the essential amino acids. It's necessary for life, but our bodies can't make it. So, phenylalanine must be acquired through foods that contain protein. Normally, once phenylalanine enters the body, most of it is converted to tyrosine by the enzyme phenylalanine hydroxylase. Tyrosine is then turned into neurotransmitters important for normal brain development and function. PKU is an autosomal recessive genetic disorder that affects function of the phenylalanine hydroxylase enzyme. The phenylalanine hydroxylase gene is located on chromosome 12, and over 600 mutations have been described. The degree of enzyme function can vary. When untreated, people with PKU develop symptoms such as severe intellectual disability, psychiatric disorders, and seizures. A pregnant woman with PKU must pay special attention to her phenylalanine levels to reduce the risk of maternal PKU syndrome that can result in heart defects, microcephaly, and developmental disability in her baby. In PKU, elevated phenylalanine levels and reduced tyrosine levels can change the way the brain functions. This is because phenylalanine uses the same transporters to get across the blood brain barrier as other amino acids, including tyrosine and tryptophan. Tyrosine is needed to synthesize dopamine and norepinephrine, and tryptophan is needed to synthesize the neurotransmitter serotonin. As phenylalanine levels rise, it occupies all transporters, making it hard for tyrosine and tryptophan to get across the blood brain barrier. As a result, dopamine, norepinephrine, and serotonin levels in the brain begin to fall, leading to abnormal brain development and intellectual disability. Testing for PKU is typically done as part of routine newborn screening, approximately 24 hours after birth. Screening is done by taking a small blood sample from a heel stick and measuring blood phenylalanine levels by a simple laboratory test. If the screening test shows high levels of phenylalanine and low blood tyrosine, a different method is used to repeat the measurement of the blood amino acids and to confirm the diagnosis. First-line therapy for PKU is the low phenylalanine diet. This includes medical foods such as low or no phenylalanine medical formulas that are a synthetic form of protein, and foods modified to be low in protein. All high-protein foods such as meat, fish, eggs, and dairy are eliminated from the diet. Measured amount of some grains, vegetables, and fruits are allowed, depending on the individual patient's tolerance.
so this is the only therapy that can be given for phenylalanine patients or alkaptonuria, whatever it is. After diagnosis, they will be treated by giving them or by having a diet
Of phenylalanine
which is having less of that particular amino acid. So coming to phenylketonuria, it's an inborn error in metabolism characterized by the absence or deficiency of the enzyme called as phenylalanine hydroxylase, which is located in chromosome number 12 and responsible for processing the amino acid phenylalanine. With normal enzyme activity, phenylalanine will be converted to tyrosine, and this tyrosine is converted to many other neurotransmitters, melanin, etc. So, all the pathway comes under this particular conversion after the conversion of phenylalanine to tyrosine. So, however, when this is absent, phenylalanine accumulates in the body and it will be converted to, when more and more phenylalanine accumulates in the blood, it will be converted to phenyl pyruvate, which is toxic to the brain. and and that will result in what is called as, because there is no much neurotransmitters during development, as this toxic material which is called as phenylpyruvate, all this will contribute to the intellectual low intellect, and also uh, reduced brain growth. So without the treatment, most people with PKU develop severe intellectual disability. To prevent intellectual disability, treatment consists of carefully controlled phenylalanine restricted diet, beginning during the first days or weeks of life. So that means the very main therapy for this is to find this soon after the baby is born. So this is inherited as an autosomal recessive pattern. As a result, the disorder will be expressed only in individuals who are having both the abnormal genes from each of the parent. So if the individual receives, or if the individual is heterozygote, there will be no symptoms. He will be acting as a carrier for the disease. So if we check the pathway, so this is the pathway. So this is a block. So we discussed about this. This block leads to what is called as uh, phenyl or PKU, which where your phenylalanine is not getting converted to tyrosine. You can see that by conversion, this pathway acts, and the same tyrosine results in the production of melanin. The same tyrosine results in the production of thyroid hormones, etc. So everything will be affected. And what happens is, when phenylalanine accumulates, it will form phenyl pyruvate or phenylpyruvic acid, which is toxic to the brain. So this is phenylketonuria. This one is what is called as this uh, alkaptonuria. This B is this particular the C is alkaptonuria, and this D is what we are going to discuss, which is called as the albinism. So this three is the inborn of the, metabolism that we'll be discussing. One is PKU, the block between here, then the block between homogentisate and melanyl coenzyme A, and the next one will be the albinism, which is the conversion of this dihydroxyphenylalanine into melanin. That's D1. When this is blocked, melanin will not be produced, and that will result in albinism. That will be discussed in the next section. So now we are discussing phenylalanine, the block between the conversion of phenylalanine to tyrosine. Okay, so the genetics is, it is the autosomal recessive inherited pattern. So untreated infants with PKU tend to have unusually light eyes, skin and hair color, light skin due to the high phenylalanine levels interfering. It also interferes with, because when it is not getting converted to tyrosine, it affects tyrosine, or tyrosine level decreases. When tyrosine level decreases, that also causes this particular melanin is not produced in much quantity, so it will not be like that of albinism. It is not complete loss of melanin, but the skin and the eye color, hair, etc., becomes light, because only few melanin, or very less concentration of melanin is being produced. They may also have a musty or mousy blood odor, body odor, caused by phenyl acetic acid in the urine and sweat. The neurological symptoms are present in some untreated patients with PKU, including seizures, abnormal muscle movements, tight muscles, increased reflexes, involuntary movements or tremors, etc. Untreated females with PKU who become pregnant are at the risk of having miscarriages and problems with fetal growth. That is, intrauterine growth retardation may happen. The next thing, which is the other one, which is the development of the particular fetus may be affected. Brain development will be affected, because these amino acids, which produces the hormone, everything is responsible for the complete development of the embryo. So that will be affected in females who are having PKU. Children of women with untreated PKU may have an abnormally small head, which is microcephaly, congenital heart disorders, developmental abnormalities, and also facial abnormalities. As a result, all women with PKU who have stopped treatment should resume treatment before conception and continue throughout pregnancy. It can be managed by metabolic geneticist and a dietitian. So, a carefully maintained diet can prevent the intellectual disability as well as the neurological, behavioral, and dermatological problems in PKU individuals. Treatment must be started at a very young age, or some degree of intellectual disability may be expected. Uh, Even some late treated children have done quite well. So, studies have repeatedly demonstrated that children with PKU who are treated with the low phenylalanine diet before the age of 3 months do well with an IQ of the normal range. So, the treatment for such inborn errors of metabolism is mainly for phenylketonuria, and the other one, it's mainly to provide the diet which is free of that particular amino acid. So that is a treatment for phenylketonuria and also alkaptonuria. So with this, we come to the end of the discussion of phenylketonuria. In the next session, we'll discuss about the third type of inborn errors of metabolism, which is albinism.